Can loop gain be measured? Have you ever wondered how our bodies respond to breathing disturbances during sleep? One fascinating aspect of this is something called loop gain. So, can loop gain actually be measured? Let's find out together. Yes, loop gain can indeed be measured, though it is not a routine test in most clinics. Loop gain refers to how our ventilatory control system reacts to changes, like a sudden drop in airflow. In the context of obstructive sleep apnea, or OSA, loop gain helps us understand how sensitive the respiratory system is to variations in blood gases and airflow. This sensitivity can lead to unstable breathing patterns, such as periodic breathing or central apneas. There are several methods to measure loop gain. One common approach is through polysomnography-derived calculations. This involves analyzing sleep study data to estimate loop gain. For instance, patterns of periodic breathing or central apnea cycles during continuous positive airway pressure titration can provide valuable information. Researchers use mathematical formulas on breathing cycle data to derive loop gain values. Another method is the breath hold technique. This simpler approach measures how long a person can hold their breath and then assesses their breathing response once they resume. This method correlates well with more complex laboratory measures of loop gain and can be done in various settings without the need for specialized equipment. The traditional gold standard methods involve measuring how the body responds to controlled changes in carbon dioxide or oxygen levels. For example, researchers might assess how breathing changes when carbon dioxide levels are increased or oxygen levels are decreased. Loop gain values tell us a lot. Values above 1 indicate an unstable system, which means the person is more likely to experience oscillations in their breathing. Conversely, values below 1 suggest a more stable breathing pattern. In patients with OSA, higher loop gain values are often linked to more complex apnea patterns. This can also predict how well they might respond to treatments like continuous positive airway pressure or upper airway surgery. While measuring loop gain can provide insights into the pathophysiology of sleep apnea, it is not yet widely used in clinical practice. This is mainly due to the technical challenges and variability involved in the measurements. However, ongoing research and simpler assessment methods, like breath hold maneuvers, are making loop gain measurement more accessible. Understanding loop gain helps explain why some individuals experience instability in their breathing during sleep. It can also guide tailored treatment strategies for managing sleep apnea effectively. So, while measuring loop gain is not routine yet, it holds promise for the future of sleep apnea management.